don't smell!
Hi everyone, I'm Dr. Kaycee Reyes. You can call me Doc Kaycee. I'm a skin doctor and the founder of Luminisce. We have featured CJ, my niece, in a previous episode featuring Melia. If you want to learn more about that, please check the link below. In today's episode, we invited her again now to talk about the condition we almost ignore, sweat in children. This is just one of our interesting episodes, so don't forget to subscribe to our channel and hit the notification bell to see more of our content.
Hi, my name is Catherine Jernurena and I'm 7 years old. Let me stop it. Yes, how is it like? It's kind of like, it's just drops. But it's not drops, it's just plain water on the underarm. That's how it feels like. I feel hot when I'm done with PE time. I feel hot and sweaty but not watery. It's just sweat. I don't like how it feels because it's too hot. So what they did is actually they wiped it first. Then they put like a brush and they put like medicine stuff on my underarm, and then they let it dry by the air. I was really ticklish and I was really cold. Yes, I did enjoy it.
Okay.
Cut!
Hyperhidrosis is excessive sweating. Children with hyperhidrosis sweat as much as 5 times more than other children. The body's way of cooling itself or sweating goes into overdrive for children with hyperhidrosis. As a result, the body makes more sweat than is needed to regulate body temperature. Hyperhidrosis can affect a child's quality of life. It can be embarrassing and uncomfortable and can cause feelings of anxiety. Sweaty palms can make it hard to hold a pencil or complete worksheets at school. Excessive sweating can impact a child's self-confidence. Children with hyperhidrosis may worry about their extra sweating and may avoid interacting with others or change clothes to stay fresh. A pediatric specialist can work with you and your child to manage symptoms and help your child regain his or her quality of life. Common causes of excessive sweating in children. Number 1. Overdressing. Keeps you too warm. In general, we should dress babies similar to adults in their home. Second, anxiety or fever or physical activity. With young children, you're probably familiar with the amount of sweat typical when they're active. Third is infection. Any typical of infection, like mild or severe, may lead to excessive sweating. Sometimes sweating is the only symptom with low-grade or smoldering infections that can get worse over time, like tuberculosis, which is a contagious disease of the lungs. Another uncommon cause is hyperthyroidism, which is overactive thyroid. It may cause excessive sweating, and it may be the only symptom, or your child may also experience weight loss, fast heartbeat, and anxiety. Fifth is diabetes. This is very rare, but excessive sweating is one of the main symptoms. High blood pressure. Certain medication can cause high blood pressure in children. The rise in blood pressure can make them sweat more. Rare disorders like pheochromocytoma, which is a tumor of the adrenal gland, or neuroblastoma, which is a brain tumor, can have the same effect. One uncommon cause of sweating is congenital heart disease. Babies with heart problems usually have excessive sweating. They get tired easily during feedings, have a fast breathing rate, cough often, and have poor weight gain. Cardiac arrhythmia can be also a cause of sweating in children, but very rare. How do we diagnose hyperhidrosis? We do it mainly by doing physical exam, where we examine the child's body and check the vital signs. And very important is the clinical history, which we talk to the mother and father and the child about the excessive sweating and when it happens and how it affects the child's daily life. The doctor will also ask questions about any family history of hyperhidrosis. Treatments for hyperhidrosis in children. Number 1, antiperspirant. A variety of antiperspirant are available to stop or reduce sweating in the armpits, hands, feet, head, and face. At Luminisce, the care and maintenance of underarm skin is one of the topmost beauty concerns of Filipinas, even at a young age. Given that it's a delicate area, it's only apt that we give it to the TLC it deserves by adding the Luminisce curations like the Crystalite roll-on to your children's routine. It's formulated to control sweat and odor and contains gentle skin-saving ingredients, which is the aluminum chlorate, which is safe for skin and fabric, and tyrosinase inhibitor to prevent darkening, and plant-derived moisturizers to soften and smoothen skin. Oral medication can also be given if it's a severe hyperhidrosis. We use anticholinergics to reduce the body's overall sweating. These treatments work best for excessive facial sweating and children who do not respond to clinical strength antiperspirant and other procedures. Botox treatment. Botulinum toxin contains a protein that turns off the body's sweat glands. It is used to treat excessive underarm sweating, but we reserve this in adult kids over the age of more or less 15 to 18. Underarm surgeries. Rarely, the sweat glands in the underarm can be removed or destroyed by excision, curettage, or liposuction. For CJ, our option is to do non-surgical, non-invasive treatment like iontophoresis, which is a process of transdermal drug delivery by use of mild electrical current voltage gradient on the skin. Molecules are transported across the stratum corneum by electrophoresis and electroosmosis, and the electric field can also increase the permeability of the skin. At Luminisce, it is combined with sweat-off RX solution, which is a combination of erythromycin and 50% aluminum chloride. It's time to push your limits and say goodbye to excessive sweating with our No Sweat Home Kit that delivers life-changing results. Hyperhidrosis is more common than you think, and our medical-grade skincare program targets exactly that. The two-step treatment starts with water-based exfoliation to prep skin, followed by the application of our exclusive antiperspirant serum. It's safe and effective in treating excessive sweating in the underarms, around the feet, on the hands, and even in the back, so you can enjoy life without inhibitions. Now, you can be comfortable in your own skin anytime, anywhere.
My mom says that it keeps my underarm dry so it doesn't sweat anymore, and that's why I have to use it every night. So in the morning when I wake up, I don't sweat. Is this on?
Yeah, it's on. It's on.
I highly recommend this for small people, big people, I don't care, medium people, I don't care. You have to use this if you have sweaty armpits. And if you do sports, whatever sports you have outside or do games outside, you have to use this if you sweat. Thank you.
I hope you guys learned a little something from this episode of Skin Vesting. Before you go, don't forget to like this video, subscribe to this channel, and hit the notification bell if you want to learn more from me and from Luminisce.